Medical scribing has become an increasingly popular extracurricular among premeds in recent years, but it's not for everyone. Here's what you need to know if you're considering becoming a medical scribe. Dr. Jubal, MedSchoolInsiders.com. This is the first video in our new extracurricular series. We'll dive deep into various premed extracurriculars to help you decide which ones to pursue. Let us know with a comment below what extracurriculars you'd like to see next. Medical scribes are assistants who help doctors and other healthcare providers enter patient information into the medical record. They work either in person or virtually to create charts in real time. This reduces the amount of time that providers spend on clerical work and allows them to focus their attention on seeing patients and providing medical care. Medical scribes are trained to document all aspects of the patient encounter. This includes the patient's history of present illness, symptoms, relevant past medical and surgical history, exam findings, lab and imaging results, diagnoses, and plan of care. As a scribe, it's your job to document the patient's entire visit from history to diagnosis to treatment and beyond. According to Medscape's 2022 Physician Burnout and Depression Report, excessive charting and paperwork are the leading causes of physician burnout. This should come as no surprise, as clinical documentation in the United States is, on average, 4 times as long as those in other countries. As a medical scribe, you have the opportunity to provide incredible value to the doctors you work with while simultaneously gaining valuable clinical experience yourself. To become a medical scribe, you do not need any formal certification or training. The only hard requirement is often a high school diploma. That being said, many employers will preferentially hire college students pursuing careers in healthcare. These students tend to have at least some background in science or healthcare and often possess a strong desire to learn and improve, which is necessary for any successful medical scribe. Although not a requirement, having completed coursework in anatomy, physiology, or medical terminology will not only look good to prospective employers, but also help you in your day-to-day work as a scribe. Being able to understand and apply medical terminology is crucial for communicating with healthcare professionals and ensuring accurate documentation. Next, let's talk about finding a job as a scribe. Medical scribe jobs tend to have high turnover rates, as most students will use the experience as a stepping stone to bigger and better things, such as getting into medical school. It's fairly uncommon to see someone working as a medical scribe for more than a few years. This means that there are often plenty of opportunities for students interested in becoming medical scribes. While not required, you can complete an online course to help you stand out from other scribing applicants. Most positions won't require this, but it may be beneficial in locations where there are limited opportunities. Regardless, scribing courses are unlikely to prepare you completely for your first job. You'll still require plenty of on-the-job training to learn the specifics of the facility that you're working at, the preferences of the doctors or other providers you're working with, and the electronic medical record or EMR that you're documenting on. The types of scribe jobs you should apply for will depend on your preferences and availability. Medical scribes are used in a variety of specialties, so your roles, responsibilities, and schedule can vary greatly depending on where you work. The emergency department is one of the more common medical scribe specialties and can offer great flexibility in terms of your schedule. EDs are open 24 hours a day, 365 days a year, giving you the ability to work nights and weekends. This gives you more flexibility to work around your classes and other responsibilities. In contrast, scribes in outpatient clinics tend to work 9 to 5 schedules, which are often less flexible. Where you are in your training and how much time you can allocate to being a scribe should be key factors in determining which jobs you apply for. Regardless of the specialty, most scribe jobs will require extensive on-the-job training. This often consists of online modules covering topics such as medical terminology, documentation, and navigating the EMR, and on-site training, which primarily consists of shadowing experienced scribes. Before you're cleared to work independently, most jobs will require you to prove yourself on supervised shifts or mock solos. The entire process takes anywhere from a few weeks to a few months depending on where you work and the number of hours you work each week. Given the amount of time spent in training and the steep learning curve, the ideal time to start scribing is when you have few other responsibilities and can put more time and attention toward it. Summer or winter break are perfect times to start, as you can allocate a few weeks to training and be well situated in the position by the time classes roll around. Many premeds will also wait until they're at least sophomores, so they've had time to acclimate to the rigors of college. By this time, they'll also have some relevant courses such as medical terminology under their belt. Others start scribing during gap years when they have few academic responsibilities and can focus solely on gaining clinical experience. Next, let's talk about the benefits benefits of becoming a medical scribe. First and foremost, becoming a medical scribe may increase your odds of a medical school acceptance. According to one study, although with significant limitations, applicants with medical scribing experience were more likely to gain admission to medical school than applicants who did not. Having medical scribing on your application can show admissions committees that you have a strong understanding of the realities of being a doctor and can work effectively in the healthcare setting. You have seen the good and the bad and are still committed to your goal of becoming a doctor. But commitment is only one factor that medical schools look for. To learn more about how to stand out on your medical school application, be sure to check out the Med School Insider's Pre-Med Roadmap to Medical School Acceptance course. Use the discount code and the link in the description for 20% off. Another advantage of becoming a medical scribe is the opportunity to earn money while gaining clinical experience. Given how closely you'll work with doctors and other healthcare providers, some view the opportunity as paid shadowing. That being said, compared to traditional physician shadowing, you're often far more involved and engaged in the patient's care because it's your responsibility to document it. Furthermore, doctors are incentivized to teach you because the more you know, the better their charts will be. This brings me to my next point, which is the opportunity to build strong relationships with doctors. Most scribe jobs will assign one scribe to one doctor for an entire 8, 10, or even 12-hour shift. Depending on where you work, this may be the same doctor every day or several different physicians that you cycle through. No matter how many doctors you work for, scribing offers you the opportunity to build longitudinal relationships with doctors over the span of months to years. They'll get to know you and your work ethic intimately and can often write strong, personalized letters of recommendation that can help you stand out to admissions committees. Scribing is also a great opportunity for personal development. Working closely with doctors and other healthcare professionals gives you firsthand insights into the field of medicine and can help you decide if medicine is a good fit for you. You'll see how doctors interact with patients and other members of the healthcare team. You'll gain a better understanding of the different roles and responsibilities of various healthcare professionals, and you'll get to see how doctors navigate difficult situations. Furthermore, scribing gives you ample opportunities to ask questions, not just about medicine, but also more personal questions. You might ask doctors about the decision to go into medicine, the pros and cons of the field, or how to get into medical school. If you work with multiple doctors, you'll have the additional advantage of receiving multiple perspectives. Scribing also gives you the opportunity to learn a ton about clinical medicine. Over time, you'll find yourself making connections between symptoms, tests, diagnoses, and treatments. You may not always understand the reasoning behind these relationships, but they can provide you with a framework to build upon later in your medical training. In some cases, you may even work at a facility that has residents or medical students and be able to listen in on the teaching moments between attending physicians and students. Lastly, scribing can help expose you to different fields of medicine. Medical scribes are found in a variety of specialties, so it's possible to find a job and gain experience in a specialty that interests you. Each field comes with its own type of patients, diseases, interventions, and procedures, and you the opportunity to see all of it firsthand. As an ED scribe, you could be charting on a patient who is actively coding. As a medical oncology scribe, you could be charting on a patient with a new diagnosis of cancer. Or as a pediatric scribe, you could be documenting on a routine checkup on a baby. If you are interested in a particular specialty, scribing can give you an opportunity to gain exposure before starting medical school. The relationships you build in a field of interest can also help you if you decide to pursue that specialty later down the road. Although there are many benefits to being a medical scribe, there are some drawbacks you should be aware of. To start, there's a steep learning curve that comes with scribing. No matter how you try to prepare, there will be tons of information that you simply don't know. And the more you learn, the more you'll realize you don't know. This can make the first few weeks or even months quite stressful. But if you can push through the discomfort and stick with it, it does become easier. Another drawback of scribing is that the schedule can be challenging. As a scribe, you'll often mirror the doctor's schedule. If you're in an outpatient clinic, this will mean working the same 9-to-5 schedule as the doctor. If you're in the emergency department, this might mean working 10 to 12-hour shifts. On the one hand, some students may find the long hours beneficial since they can work fewer shifts per week. On the other hand, long shifts can be more difficult to fit into an already busy schedule. The last drawback is compensation. Many medical scribe jobs will pay close to minimum wage, especially if you work for a large medical scribe company. If you work for a smaller group or private practice, you may earn slightly more per hour. In addition, there is often little room for growth in terms of compensation unless you become a trainer or take on more administrative roles. Medical scribing has become an increasingly popular extracurricular among premeds in recent years. That being said, what the job lacks in compensation and upward mobility, it often makes up for through the clinical experience you gain and the relationships you make. If you've decided to become a medical scribe, here are some tips to help you get the most out of the experience. First is to be curious. There are few other jobs, if any, that allow you to work more closely with a physician. Take advantage of the opportunity and learn as much as you can. Ask questions and look things up whenever you don't know something. Pay attention to patterns and try to get a feel for how doctors think. The more you know, the easier the job will be and the better you'll be at it. Next is to be flexible, especially if you're working somewhere that requires you to work with several different providers. Everyone practices medicine differently. Some doctors will be incredibly thorough with their charting and want every minute detail documented. Others will take a more minimalistic approach and only want the most important details documented. There's not necessarily a single correct approach, so you'll have to be flexible and adapt your charting to the style and preferences of the person you're working with. As a medical scribe, you also have to be efficient with your workflow. Depending on the specialty you work in and the specific doctor you work with, you may end up seeing a high volume of patients. If you work in a busy ED with a highly productive physician, for instance, you may see more than 50 to 60 patients in a single shift. As such, you need to have systems to keep you organized and efficient. Some helpful strategies include having a catch-all Word document to write information in a pinch, practicing keyboard shortcuts, and using common medical abbreviations to streamline your workflow. Experiment and find what works for you. Lastly, you should make it a point to get along with everyone you interact with. Keep in mind that people are shades of gray, and everyone has something to teach you. Although you may encounter doctors who are difficult to work with, you're ultimately trying to get to where they are. This means that even if they're rough on the outside, there are still many things they got right. If you adopt this mindset, not only will you have better relationships with the people you work with, but you'll also learn more in the process. And that's everything you need to know about becoming a medical scribe. Is there anything I missed? Let me know with a comment below. If your dream is to become a doctor, be sure to check out the Med School Insider's Pre-Med Roadmap to Medical School Acceptance course. We cover the nuances and details of how to be a standout pre-med, including course scheduling, extracurriculars beyond just scribing, research, common mistakes and pitfalls to avoid, and our tactics to securing full scholarships to top medical schools. This is the guide we wish we had back as premeds ourselves. If you sign up using the discount code and link in the description, you'll receive 20% off the course. Thank you all so much for watching. If you enjoyed this video, check out Premed Extracurriculars for med school apps and what I did, or this other video. And make sure to subscribe so you don't miss out on any future videos in our Premed Extracurricular series. Much love, and I'll see you guys there.